Have you ever taken your pet to the veterinarian, gotten the bill, and thought, wait, how did it cost this much? You're not alone. Pet owners love their animals, but veterinary bills can sometimes feel confusing or even shocking. Today, we're going to break down where that money actually goes because veterinary clinics aren't just small offices, they're essentially miniature hospitals for multiple species. And once you understand the costs behind the scenes, the numbers start to make a lot more sense. A veterinary clinic functions much like a human hospital, but without the benefit of large insurance systems covering the majority of the costs. In human medicine, insurance companies often absorb the majority of the expenses, so patients don't actually see the real cost of treatments. In veterinary medicine, however, pet owners typically pay the full price of services directly. That would mean every test, medication, and procedure is reflected in the final bill. Let's start with the biggest factor, overhead. Running a veterinary office involves the same operational expenses as many medical facilities. Typical veterinary practice expenses include rent or mortgage, utilities, insurance, medical waste disposal, equipment maintenance, laboratory services, and computer systems and software. These fixed overhead costs are required just to keep the clinic open every day. Imagine opening a restaurant, but you before you sell your first burger, you already have to pay for the building, the kitchen equipment, the staff, the electricity, and the ingredients. Veterinary hospitals operate the same way, but the equipment is closer to hospital grade medical technology. One of the biggest costs in veterinary medicine is labor. Believe it or not, labor, just like a lot of other things in many other fields, is oftentimes the highest in terms of cost. You have to be able to pay the professionals that are working for you. Veterinary clinics rely on highly trained professionals, including veterinarians, licensed veterinary technicians, assistants, receptionists, and practice managers are just a few of those that might be in your clinic. Labor alone can account for around 40% of a veterinary practice's expenses. Veterinarians go through roughly the same amount of schooling as physicians, often 8 years or more of education, yet typically earn far less in comparison. Think about a routine surgery. Even a simple spay procedure might involve a veterinarian performing the surgery, a technician monitoring the anesthesia, another technician assisting, a nurse in recovery, and a receptionist managing the records. That's 5 trained professionals working on one patient by themselves. Veterinary medicine uses the same advanced technology as human healthcare, and as a result, oftentimes the expense of upkeep of those machineries is very expensive. Examples of common equipment is very similar to humans, being that x-ray machines or, say, ultrasound systems, surgical monitoring equipment, blood analyzers, or dental radiology units. Many of these machines cost tens of thousands of dollars just to have in the clinic, not mentioning anything in terms of repair or maintenance has to be done on them. And the clinics must maintain them, they calibrate them, and replace them over time. If your dog is getting an x-ray during a visit, you're not just paying for the image, you're paying for the x-ray machine itself, the technician running the scan, the software analyzing the image, the veterinarian interpreting the results. Even diagnostic tests like blood work or x-rays can add hundreds of dollars to a visit. Going into medication and medical supplies, veterinary hospitals also need to keep a large inventory of medications and supplies ready for emergencies. This may include IV fluids, antibiotics, anesthesia drugs, surgical tools, bandages, and even vaccinations. These supplies are part of what's called cost of goods sold, which can represent around 22 to 24% of clinic expenses. On top of that, medication costs themselves can rise due to inflation or shortage of supplies. Modern veterinary medicine is more advanced than it has ever been, which is another reason why it's become more expensive, is because of the level of care has dramatically improved. Pets today can receive treatments that only existed in human hospitals only a few years ago. Examples of that can include having an MRI scan done, chemotherapy, orthopedic surgery, physical rehab, and advanced dentistry. As the medicine evolves, it naturally requires more specialized equipment, training, and expertise. Let's look at a few realistic examples of veterinary costs. In a routine visit, the average vet visit for dogs is usually around at $214. Cats around $138. This would include exam, vaccines, and extremely basic diagnostics. This wouldn't include anything like how you would go to your own doctor and have, say, blood work, urine done, or anything along those lines. For an emergency example, if a dog swallows, say, a foreign object of some kind, possible expenses may include the exam, x-ray, anesthesia, abdominal surgery, and hospitalization. And this can reach anywhere from $1,000 to $10,000 depending on the severity of the situation. Over the course of a pet's life, the cost of care can add up significantly. Some estimates suggest that lifetime veterinary care for a dog can exceed $30,000 depending on health issues and emergencies. But that includes years of preventative care, diagnostics, treatments, and sometimes surgeries. Veterinary medicine isn't expensive because veterinarians want it to be. It's expensive because running a hospital with trained professionals, advanced equipment, medications, and emergency readiness is simply costly. There's no other two ways about it. The goal of veterinary professionals isn't to maximize profit. It's to provide the highest level of care possible for the animals we love. So the next time you're at the veterinary clinic, remember, you're not just paying for a visit, you're supporting an entire medical team, advanced equipment, and a hospital designed to keep your pet healthy. And for many pet owners, that care is worth every penny.